And today we have the pleasure to have Dr. Richmond on the line with us today. How are
Hello,
you
good
doing, Dr.?
afternoon.
So,
Hello, how are you doing today on this Sunday?
I am doing well. All things considering, God is good, life is good. I woke up with my eyes, opened my eyes this morning, so I'm doing all right.
I know that's right. And listeners, if you recognize you're not seeing us today because of the COVID-19, you are not seeing us today. So you're just going to hear our voices because we are all in different places, abiding by the rules that they have put out, asking everybody to stay apart and try to quarantine if you can. So here we
6 feet
are
apart,
doing the show.
10 people or less.
Yes,
Yes, look, AKA social distancing.
yes.
Yes. Some of us have mastered that already, and there's some that are going to have to adapt. So
And
all the
yes,
I'm
introverts,
adapting.
I'm sure
I'm
they're
adapting.
appreciating
Yeah,
it. Okay.
no,
yes.
absolutely.
And
Okay,
so,
so like I feel like we have the perfect person on the show today, considering what's going on in the world right now.
yes, yes, definitely.
Well,
And
thank
so,
you.
oh, go ahead, Dr. Richmond.
No, I was just saying thank you. I appreciate that. I am a board certified family medicine physician as well as a public health professional. So it actually all timing was perfect.
Yeah, that's awesome.
Oh.
Nikki, great job.
Yes, this is perfect timing. Everything happens for a reason because we've been having to unfortunately reschedule, and so
Reschedule. Yep,
everything happens for a reason.
absolutely.
So,
Absolutely.
Dr. Richmond, tell us a little bit about. I mean, have things been crazy for you at your doctor's office? Have you had to shut everything down temporarily? Can you tell us about how
hmm
it's going for you guys in private medicine?
Okay, so in private medicine, we have been charged with, and we say private medicine, that means a doctor that owns their own practice in the community outside of a large institution or facility or group of doctors. And so in my practice, and I know even in my doctor's practice that I go to, we are all trying to help keep as many people that don't need to go to the emergency room or the hospital from doing that. And so, what a lot of us are doing, and what we're charged to do, and also what the medical societies and the people who govern us have given us a little bit more leeway with telemedicine, so that way we're not being exposed as much or exposing other people or patients who would typically be, let's say, in the lobby. And so
Mm-hmm.
we're able to use, I know a lot of people say Skype or Zoom. It's a different name for medical platforms, but it's that same concept where we're able to use those for medical visits as well as talking with our patients on the telephone.
What a time to be alive. That's so
I
amazing.
know,
Yeah,
I know. Which, logistically, oh my goodness.
Yeah, I can
Because
imagine it's work.
everything happens so quickly. You have to make it work. Figure out which platform you're going to use. Um, Informing the patients, educating the patients, and just making sure that they understand that this is still high quality. Um, Healthcare is just in a different format, and the world was kind of already going towards telehealth and telemedicine, but
Mhm.
right now we have basically been catapulted into this method of offering healthcare.
Like
yes,
basically, you're gonna learn today. Like we need
yes.
to
Right. Yeah. Yeah. You're going to have to learn today. We're going to send you a link.
right.
Go online. And, some people we have to say, go to www
Yeah,
Yeah.
and click on. And so, but it is a way, again, to keep down exposure, to flatten the curve, to still do social distancing, but also to help our patients and to help our fellow colleagues who are, at the emergency room, who are at the front lines trying to take care of patients who either have medical problems that are acutely, there's something going on, like if they're having a heart attack or they need something done right away, or those who are having symptoms that are really like on the more severe extreme of
Mhm.
COVID-19, COVID-19 exposure. And so this is a way for us to help everyone, the healthcare providers as well as the patients, to kind of keep the systems from being so clogged.
Okay, but
Mhm.
that's on the positive aspect. But what about how does it negatively impact those who are older who don't necessarily know how to operate the internet or may not have access to it? How does that affect those individuals?
Right. So that's why we still have, fortunately, we still have good old telephones and telephone numbers.
Mm-hmm.
Where if they are not savvy with the computer or internet, or for whatever reason don't want to be on a screen, that is why we have telephones still, and so we can use those and talk. And typically the elderly, more seasoned patients are comfortable with the regular, telephone call. And at that
Exactly.
point, what we're doing is, particularly if it has anything to do with COVID ID-19, is, and the symptoms, is to triage them, meaning assess like how they're feeling. Do they feel short of breath? Have they felt like they had a fever? And if they should go to the emergency room.
Okay.
And so that's another way. We do have also the option of having patients drive up to the clinic and having the doctor go out to the car and assess the patients that way as well. But we're still working on having enough equipment to make sure that we're covered when we do go to check on patients in person.
Hmm.
Wow, this is all so like interesting and crazy how this is going right now. To say that, who would ever thought you would ever have to see a patient in their car?
No, seriously, who would have ever thought? And that is really where we are today. Because if they are positive and you have them to come into the clinic, that means that everybody is exposed. The staff, the doctors and nurse practitioners, everyone is exposed, and so
Yeah.
that adds, cumulatively to the problem. Um, and we're still not, we still don't have testing readily available. Um, so you don't know who's positive, who's not, until they can get a test and get the results back. So it's very, you have to be very, very careful.
So,
Wow.
question: do
Wow.
you know how the testing process goes as of yet? Have you had to do testing for individuals yet?
So I've requested testing, and it's been, the shipment has been delayed twice already. So I haven't had an opportunity to do the actual test, and it's really just a swabbing and taking a cotton tip and taking a sample from either the nose or the throat and sending it in. But it's a specific test for this strand of the virus.
Mm.
Wow.
Yeah.
And when you say the strand of the virus, there's many different strands of this virus already out, or it's been
Right.
out
Yeah.
already.
So coronavirus is a virus that we've known a lot about for a long time. And it typically, if you get it, you typically get mild symptoms, but that is one strain. So I like to akin strains to, there's one family, but it's all different cousins, right?
Mm-hmm.
Hmm.
And so every cousin is different. And this COV, well, actually the name of the virus is the SARS, is actually called SARS-CoV 2. And this virus that causes the COVID ID-19 symptoms that we see now, um has, we don't know if it's because viruses and bacteria, these little, like, basically like bugs that we don't see, they
Mm-hmm.
actually have the ability to kind of change themselves and make
Mm.
themselves more stronger, more infectious, easier to contract. And so we don't know exactly if that's what's happened, but this is one of the cousins of that group that is causing us a lot more problems than anticipated. But if you look at different products, it'll say coronavirus. If you look at something you had from like 2 years ago, it'll have coronavirus on it. So it's not that it's a new family. It's just this particular strain is pretty infectious and can cause problems for particular people in the population.
And you know
Wow.
what? This is, and remember, Danielle, this is just what we were talking about. Because remember, I remember you told me that last week. You said You see, it's on the back of your Lysol bottle.
Oh
Corona.
yeah.
Hmm.
I've been
Yeah.
seeing it for years.
Yeah.
Yeah.
Wow.
So
This
it's
is
not anything
crazy.
new.
Yeah. Oh my God. This is crazy.
So
Yeah.
I have
Yeah. And
another question. Oh, go ahead. Go
sure.
ahead.
No, no, no. I was just gonna say the more we learn, the like it feels like, and this is not a medical term, the crazier it gets. It's just like, wait, what? So
Yeah.
we've been around this all this time. Now all of a sudden we have thousands and thousands of people dying from it. Yeah. So it's pretty deep and very interesting. I think in the next coming years it'll be very interesting to see what we actually find out about the virus and how it evolved, and what we figured out can help either prevent it or treat it, which we don't
Yes.
have those all those answers right now.
Yeah,
Yes.
and that was leading into the next question is I wanted to know your thoughts on how you believe this strand has come into not existence, but mobility, right? It just all of a sudden became mobile.
Yeah. So and it's so when we say mobile, okay, so if we are what's called the vectors, if people are who this virus can live in, then we know that somebody from somewhere brought it to this place and it went from that place to the next place. And I don't know who traveled from where. They're saying that someone came in from China into the States, and it started with one and then it just went from there. But that's why public health is so fascinating, because this is how it happens, where you start all the way on the other side of the earth with this problem, and it finds its way really around the earth, um, into different countries, and finally lands in the US. And it's a matter of public health that somebody with this virus traveled and brought it with them.
Hmm.
Yeah. Yep.
Wow. And it spread so quickly.
And it spreads so quickly. But this is another public service announcement. So I've been seeing patients over 10 years now, and one of the things that I end up doing a lot of, especially in cold and flu season, is education. Because the minute we get a sniffle, the minute we get a cough, we want antibiotics. And antibiotics don't work for viruses. They just don't. They're not meant for viruses. And those first few days, particularly like 7 days, 8 days in, most likely that's a virus. Your body is going to clear it out and things will get better. However, we want a pill. We want to get it done so we can go and do all the things that we can't do now. Go to work, go to hang out, go to do this, go to do that, and thinking that the antibiotics will make it go away sooner. However, when we constantly taking antibiotics, we're teaching these mini micro bugs how to basically eat those
Resist.
antibiotics up and become
Mhm.
stronger,
How to resist. Yep, yep. How do
and
I
how to
avoid this?
resist.
Hmm.
Yeah, so it's amazing because these little bugs that we don't see, they are just making their little cells stronger and stronger. And that's what happened with the coronavirus. It's just is a strong, infectious little virus bug.
Wow.
Wow. And you know
Yeah.
how they say, what's the saying they say? What you don't know can't hurt you, but actually what you don't know can kill you, you know?
Oh
Oh yeah,
yeah. Yeah.
100%.
In this
one
Wow.
hundred
situation
percent.
for sure. And it's crazy because it's really like a movie, like because it's something that you
Yeah.
cannot see. All you can do is
Right.
just like on the movies, is do your best to try to protect yourself from it. But it's something you can't see. It's there and you don't even know it's there.
Hmm. Absolutely, absolutely. And I think that's why so many people initially were having such a hard time, like, okay, social distancing, or oh, you telling me I can't go out, I can't be next to people, I can't shake their hand. And seriously, it's because you really can't see it. So the best
Wow.
thing to do is to kind of stay separated in this moment, so that we're not unknowingly transmitting this virus to one another.
Mm. Wow. So,
Wow, that is
Doctor,
crazy.
Y'all so
yeah,
quiet.
We're just
this
taking
is
it in.
great. Yeah.
Yeah. So it's really like I've been telling my children, like, it's really real out here. It may not feel like it because we can't see it, or it hasn't directly affected us, but it's a real thing. And Houston in particular is a large city with a lot of people,
Mm.
a lot of people. It became a travel hub with more international travel. And
Yes.
so
Yeah.
we got to do our part. It's almost like your like you have your civil duties. This is like a public health duty. Stay in and do what you need, and only go out and do things that you need to do.
Yeah.
I agree with
um
that.
yeah.
I mean, now Wuhan, China has zero new cases of the corona COVID. However you call it, 19. They don't have any new
Hmm.
cases, and that's because they really cracked down. And we all know that yes, they're a communist government, but I really like their efforts in making sure that people do not just aimlessly wander, go out and still have
Hmm.
gatherings and things like that, knowing that it was so extremely infectious. And I don't know if they had as many casualties as Italy did, because let's talk about how many people died in one day in Italy.
Yeah.
Like I think over
Yeah.
700 deaths yesterday or day before. I mean, it's just insane high numbers of people that are just dying from this disease. Can you tell us a little bit of why you think this is happening or affecting Italy so hard?
So, I was actually, what I do every morning, I try to stay away from non-medical or non-factual information. And so, but every morning to keep abreast of what's going on in the world, and the thoughts behind what's going on. So the population in Italy, they live a long time. And so they have a higher population of seasoned and elderly people, who we
Mm.
know
Okay.
now, or at least that we know of up until now, are the ones who are most susceptible to what we call morbidity, meaning the worsening of the disease and how they respond, and then mortality, meaning death. And so I think that those high numbers come from a lot of the fact that, one, maybe the social distancing and everything was not kind of instilled immediately, and then two, they just have a higher population of elderly people that were exposed to the virus.
That makes sense.
Yeah.
That
Yeah,
makes
that
perfect.
does. That makes a lot of sense. I had no idea that Italians had such a long lifespan.
They do. Yeah. Yep, they do. Yeah, and actually in a lot of other countries, they do, health wise, they do better than we do in the United States.
Talk about
It
it.
makes
Let's talk about it.
Yeah.
And you know why? It's
I
because we
mean,
do
we
a lot of driving. We do a lot of fast food eating. I mean, you can tell them
yeah,
like what.
yeah. We live very sedentary lifestyles, and not so much sedentary like I sit at home on my couch all day. Some people have that part of their life that's sedentary, but going to work, sitting at the computer, like, because there's so many advances, we have a lot of comforts that a lot of other people or other countries don't necessarily have. We drive a lot of places. In Houston, I was amazed. I'm from Chicago, and so moving here, I was like, okay, so the only way we're gonna get somewhere is if
Is
we
if we drive.
drive. Okay,
yep.
all right, well, yeah, this is interesting.
Yep.
And then having the luxuries of eating out at restaurants, and being able to drink alcohol, and having access to cigarettes, and then on the flip side of that, having a health system where insurance and insurance is almost a luxury. Don't tap my hand, but it is. We just started to have some options where people could afford some level of health care, but
Right.
it's still a lot. And when we start talking about deductibles and co-pays, and so that's a whole different platform and conversation. But um so all of that together, and you would think we have the most resources in the world, but health wise, we were already doing poorly in comparison to other countries before COVID-19.
Right. And that's the truth.
Yeah.
And you got to think about it. Nowadays, we have people that are our age, me and Nikki's age, in their 30s, with high cholesterol and diabetes and things like that. And it's simply because we're not walking enough, we're not exercising enough, we're not doing the things naturally that we would be doing had we not had the amount of technology that we have and things like that.
Talk about it. Talk about it.
Right.
So in my practice, I really do have those real conversations. I do not want to prescribe every time something comes up and say, oh, you need to just take this medicine to fix it.
Right.
No, we got to talk about lifestyle. We have to talk about stress management. We have to talk about, so when I say lifestyle, what you're eating, what you're doing for exercise, how are you taking care of yourself? Do you pay attention to how much you're eating? We have those real conversations and come up with solutions outside of prescriptions. Now, some people are at a point where, you know, if I don't prescribe medications, they could have a stroke or a heart attack, or their kidneys may fail. Then we're definitely gonna talk about, you know, medication and things like that. But if there's a way for us to get you to change your lifestyle, and because if you lose weight, your blood pressure will go down. The evidence is there. But it's about being consistent and actually doing it and realizing that these are changing things that you do can be life-saving is what I'm trying to talk about in one of the platforms that I have with my patients. Because it's not all about prescribing medicine. Because sometimes we can still prescribe medicine, and if you keep doing what you're doing, the medicine's still not going to work.
Absolutely.
So true.
Yeah, it's a lot. And my staff there was like, Dr. Richmond, you need to hurry up. And I'm like, no, but I need to have these conversations.
Right.
Because if not, then it won't be so much that the visit is so long. It'll be that they'll be back again and again and again, and then eventually in the hospital. And if we can prevent any of that, I'd rather do it right there in the moment when I have you with me than to, you know, keep prolonging and letting things get worse and worse.
I like
and
that.
Yes, and younger people are coming in with high cholesterol, high blood pressure, pre-diabetes, which is you're not quite there yet, but if you keep going the same way you're going, you're gonna be diabetic.
Right.
And we can fix some of that. We can fix some of that.
We don't think about that when we're going to go get those nachos topped with fajita steak, because I want some right now. You know what I mean? And knowing that I'm not going to go work out after I have it. Plus, I'm going to have a margarita. Why? Because I feel like I'm a little stressed out. You know, I'm giving it as an example because I used to do that a lot when I was in my 20s. And as I got older, I said, my body is going to break down if I keep living. And don't get me wrong, I can eat. But what I do is I try to eat consciously now. I really do. Like I'll have my cheat days. Yeah, especially on the weekends. But throughout the week, sometimes I'll just eliminate meat for like a few days, not every day, but just a few days. And I'll have more vegetables and grains and rice, you know, throughout those days that I'm not having my meat, and fruits, you know what I mean? And then, you know, maybe I'll flip it the next 2 days and have meat and protein and vegetables for the next 2 days out of the week. And then the weekend, come on, nachos, you know what I mean? It's not good, but at least I'm trying to balance out, and I'm not eating bad every single day. Yeah.
And sometimes it's just even a matter of just cutting your portions. Like, again, I'm from Chicago, and not that we don't eat a lot of food and we don't have good food, but here in Texas, that is enough food for like 4 people.
Yeah. It is. Yeah. And sometimes we eat that in one setting.
Eat half the plate and take half of it home. Or take some, when you sit down and eat with somebody else, why don't y'all come up with something that y'all can share if it's something that you just feel like you really must have. But that usually I'm exaggerating, maybe saying 4 people, but 2 to 3 people can feed.
No, you're right. In Texas, everything is big. Yeah, everything here is big.
Really
the
is.
Portions, everything. The distance.
I tell my friends at home, I'm like, no, that's for real. Like, they not just saying that. It's for real.
Yeah, because
and then not only that.
I was gonna say because I've went to other states and their portion sizes were not the same, and I thought something was wrong with them. I felt cheated.
Right.
So
seriously.
And then, you know, on top of that, we eat a lot of heavy meats too. Like we eat pork ribs, we eat steaks, we eat, you know what I mean? huge
Mm-hmm.
steaks,
Mm-hmm.
it's like it's super heavy and super large, and your body needs time to
Yeah.
digest and break that down.
Digest it.
Yeah,
Seriously. You're thinking, why is my stomach hurting? Yeah, oh, it's definitely what you ate.
Yeah.
And your body is just trying to get rid of it, basically.
Yeah.
right. Yeah, I mean, I remember I just had a baby almost 2 years ago, and I was saying, "Wow, it
Okay.
sure is taking a long time for me to drop this weight." But one of my friends said, "It's because you keep eating. You keep eating like
Right. That is
you eat like you still pregnant. That's why you
pregnant.
can't."
Listen,
It's
after
so
two
true.
years, that is no longer baby weight.
There
That's
you
not
go.
baby weight.
That's all me now.
My
That's all
youngest
me.
is 5. I said the same thing. By the time I'm like, he's 2 years old, I'm like, yeah, this not baby weight anymore. I got to stop saying that.
That's right. That's right. But it's interesting that we were talking about how the Italians they live longer, and they eat tons of pasta, but they also eat tons of
Hmm.
vegetables too. A lot of natural
Yes.
fruits and vegetables they grow in their yards. And so that's
Yes.
something that we can also get back to as well. And I
Yeah.
think, and maybe you would agree, Dr. Richmond, is that a lot of us should really definitely go back to the basics and start thinking
Yeah.
about when we go buy groceries, are they really what we think they are? Or can we just simply take out the time and grow some of this stuff in our backyard or create a little mini garden that can in containers? If you don't have a backyard,
Hmm.
you have an apartment, sit it outside on your back porch or whatever and let them grow and eat from what is coming from something that you planted. So you know what's going inside
Absolutely.
the body.
And two, I don't know if I've never been to Italy before, but I see things on television and how the architecture and how the cities are. And honey, they walking and those stairs,
Mm.
for you to get to your house, you got to walk like a few flight of
Yeah.
stairs to get
Mm-hmm.
home. And so they do a lot of ambulating. That means walking and moving. Um, that's contributing to their longevity and lifestyle improvements, or their lifestyles that allows them to live for so long, even though they eat a lot of pasta.
Yeah, yeah. Because they're working it off. And that's the thing that we
They're
don't do.
working it
We'll
out.
we'll eat a ton of
Yeah.
pasta and we're gonna go home and lay down and go to
Oh
sleep.
yeah.
That's it.
Oh yeah. Quickly, like, oh, I'm tired, because it's make you feel tired and heavy. So you're like,
Right.
you know what? Let me
Right.
just go ahead and lay down. Hmm.
So let us ask you, how long you say you've been in practice for over 10 years?
So I've been seeing patients. So I moved from Chicago after medical school to do my residency here at Baylor.
Mm-hmm.
And so at Baylor, they have two programs. They have one that's a private medicine program, and then they have the other, which is a community medicine program. And I went through the medicine program, and so I rounded and saw patients at Ben Taub, and then also our community clinic was Northwest Clinic, which is a Harris Health clinic. For those who are not from Houston or in the Houston area, it's very much it's a county system or public medicine system, and so you get to see so many different um, diseases and pathologies and different types of patients, and culturally is such a diverse and rich system, uh, and that's why I chose it. And once I finished there, this is when I started seeing patients. So I started seeing patients after residency, and I first started at UT at Acres Home Clinic and LBJ Hospital. Stayed
Mm-hmm.
there for onwards of 6 years, and then I transferred from there and came back to Baylor, which was closer to my home, to MLK Clinic, which is this South Park, Sunnyside area,
Mm-hmm.
and worked there for about a year and a half. Um, and then a little bit of what we call locums work, where I would just go to different offices and see patients that were not necessarily my patients. And then eventually I decided to go out on my own. And so my practice that's been my own opened January 2nd. So
Oh,
yeah.
congratulations.
Yes.
Fresh.
So I'm very new at that part of it.
Wow. What a year so far, right?
Yes, what a year so far, in transitioning from being able to, have my patients and see them in person, to going to telemedicine, and then what the state of our health system is in now, and being a part of it as well. It's been a whirlwind, needless to say.
Wow, I can imagine. Nikki, wow, do you
Mm-hmm.
hear
Yeah,
her?
yeah.
January 2020.
January 2020.
I feel like it's been a year already. It's only been 3
I
months.
know.
No, for real. So January, I know some people are saying just throw the whole, and I don't want to say that, but I understand why they feel like
Yeah.
that because January just seemed like it was just
Oh yeah.
tough. I was like,
Mm-hmm.
okay, is it ever going to kind of level out? January is supposed to be like a new beginnings, and yeah, no,
I just think
January was tough.
this year is gonna be full of challenges, and I think a lot of truths are gonna surface this year. I think that the
Mm-hmm.
world and the people in the world are shifting and transitioning. There's gonna be
Mm.
what we see a lot of deaths, a lot of births, a lot of people changing their minds about what they thought they wanted to do in life. You know what I mean? And
Mm. Mm-hmm.
awakenings are gonna happen. I don't know. This
Mm-hmm.
is the year for that. I don't know why, but it is. It's here. And you can see it. It's self-evident everywhere.
Yeah. Yeah.
Everywhere.
Yeah.
Wow.
Now we have his time on our hands. So
Mm-hmm.
we had to, we figuring it out. And I was listening to this young man out of California. He's a personal trainer, and he asked everybody, what will y'all do if the internet just shuts
Oh
down?
Lord.
What y'all
Mm-hmm.
gonna do? I said, I listen, me too. I like touched my chest like, wait, hold on. Now you taking this a little bit too
For
far.
real.
But we had a couple of internet surges though, yesterday or the day before, because there's so many people on the internet.
Mm-hmm.
Sometimes you may notice it's a little bit slow.
That's what I was just about
It
to
is.
say.
It's extremely.
Yeah, because I know my phone. I thought it was just my phone, but I'm like, my phone has been acting crazy all weekend.
Yeah,
Mm-hmm.
yeah. So order some books and yeah, order some books, a few journals, and whatever you read the Bible or the Quran, like make sure you have it because just in case we need
Right.
to be prepared. If
and,
that
and,
does
and
if that does happen.
mentally prepared is the main thing, because I think a lot of people are not going to be mentally prepared for something like
Hmm.
that, because we've been so
Yeah,
dependent on the easy way of life, right? You just go into a
yeah,
room and turn on the lights. Well, if there's no
yeah,
electricity, plus there's no
yeah.
internet, what are you gonna do? You
What are
know
you
what I
gonna
mean?
do?
Yeah,
Yeah,
you have to be.
I did mission work in Haiti. And
Hmm.
so we started out, we landed the first day in Port-au-Prince, which is the large city in the capital. And the internet is available, there's running water. And we were going up into the mountains and to this small village called Gandu. And they let us know ahead of time before you go. Make sure you get you a good shower because there's not running water. If you need to take care of any business as far as the internet, go ahead and take care of it, because the internet is very, very limited. If you can get a signal, there's no television, there's no radio. Um, so be prepared. And when
Hmm.
we went, one of the things that I noticed is that a few things, the natives, they were fine, like they were good with life. They were very family oriented. They grew their own food. And they are, from our perspective, uh are quote unquote poor, but I thought the smiles, the music that they make just on their own, like without like formal instruments.
Hmm.
They live a very, very simple life, but rich.
Yeah, yeah. That's what I get from it. A very rich
And
spiritual life too. Yeah.
very spiritual life, very family oriented life. If one person was coming to the clinic to see us, everybody came. And everybody
Hmm.
wants to know what they needed to do, how they needed to do it, to watch out for each other and look out after each other. There was one man who had a stroke, and everybody is walking on foot. They do have some cars and motorcycles, but a lot of the people don't. And they carried her I think 2 or 3 hours to get to the clinic so that she
Wow.
could be seen. Yeah,
Oh,
yeah.
That's
It's
see?
amazing.
it's still people in this world who are living without all of these wonderful amenities that we're having, and they're still living.
Yeah.
They're still enjoying each other. So I brought up that because reminds me that we can live without all these amenities that we have and still be happy and still interact with one another and still have love and happiness and joy, without all of these things. And so hopefully, if that ever happens, that will be the case. How do we counter that with having to social distance right now? I don't know, but I hope we end up somewhere in the middle.
Yes, me too.
Yeah, where we're not so used to social distancing that we don't want to socialize or be close anymore.
Yeah. That's
Yeah, I think that would be hard to break. What do you think,
Yeah.
Nikki?
well. That's what I was about to say. That's what I'm afraid of. In a sense, is I'm afraid of people. Unfortunately, even when this, somehow comes to a head, for some people to just really allow it to continue to allow them to distance themselves from people.
Mm-hmm.
That's something that I definitely am concerned about, because it's nothing like social real touch. It's nothing like
Yeah.
that.
Yeah, no, absolutely. Absolutely. It was hard for me to say, you know what? Um, it's okay if we don't meet in the studio. That was hard for me
Yeah,
because I'm like, I want to meet in person. I want to say,
Hmm.
hey, sister,
yeah.
give hugs and all that good stuff. And it's like, oh, okay, all right. So I guess I look on social media and try to connect that way. I don't know.
Yeah, yeah.
Well, sometimes we have to do what we have to do sometimes, but
Yeah,
this will soon pass and I think we'll get back
I
to
agree.
normal. I hope. I hope.
I mean,
At
we
least
made it.
maybe
We
by
made
the
it
end of the year.
through. We made it through the hurricane. We made it without electricity. We made it
Mm-hmm.
without being able to leave and go to the grocery store. So we from a local perspective, Houston, I feel like has a heart that does not go away even with hard times and difficult situations. I feel like when we came out of the hurricane and everything that we had going on with that, I feel like it made us closer. Like you could feel the appreciation for one another when we were finally able to get out and move about. Like people are smiling and hugging and saying hey.
Mm-hmm.
And so
Mm-hmm.
I hope that we have that energy locally and across the United States with once this passed. But I agree, Danny, that this too shall pass.
Oh yeah, definitely.
Definitely. I'm praying that it will. We're down to our last 11 minutes. Nikki, did you have any more questions for Dr. Richmond?
Yes, definitely.
Because we want her to shout out.
Well,
Mm-hmm.
yes,
Go ahead.
definitely. So, Dr. Richmond, I definitely want to ask, in your medical opinion, I've seen on the news where they say they have a couple of, medications that they've been, trying out with different people to help them get rid of the virus, to treat them for the virus. In your opinion, how much longer do you possibly think that this could go on?
So the actual treatment or
Oh, this whole
the
deal,
extent
like
of
how,
the virus?
yeah, like what is just your prediction, like on how much longer you think this possibly can go on before something comes to a head?
Yeah. So I don't think right now that we're at the peak. And looking at other countries, we are kind of at the beginning on where the slope is starting to go up. And we will see more positive cases. I don't want to say that we're going to see more morbidity and mortality. However, the rate we're going right now, that looks like that'll be the case, and then eventually that curve will start to go down. And I'm prayerful that this will happen because we have information from other places. I am hopeful and prayerful that this won't last more than a month or two. But if we look at China, we had December, January, February, March,
Mm,
4 months.
yeah.
And so if we
Mm-hmm.
look at that trend, hopefully we'll be able to shorten it as we try to get um before the ball. We not there yet, but trying to get there. And then I also wanted to say concerning the medications and things, please people, don't just go out and start getting these prescriptions or these medications or getting medications on the black market because people are saying that these medications work.
Mm,
The truth of the matter is right now in this time,
time and space, we do not know. And there are not any FDA approved medications or treatments for this. And some medications can be more harmful than helpful when it comes to treating the virus. And the truth is, a lot of us will actually have come in contact with the virus, have the virus, and the virus has been in our body and has passed, and we don't know, obviously, because of the we're not just routinely testing everyone, so we don't have the real answers for that. But I'm prayerful that this will be no more than 2 or 3 months, but we see that the trend is about 4 months or so.
Okay. So we all know, hey, we have got to pray and we have got to believe, and to help
Yes.
with this issue, we need to follow the rules and
Yes.
stay in quarantine if we don't have to go anywhere. But we definitely want to continue to keep all of our medical staff. I'm a phlebotomist.
Absolutely.
Yes, keep all of us, doctor, everybody.
Absolutely.
I even seen a post on Facebook today about daycare workers. People
Yes.
shout outs to healthcare workers, but what about the people who are still keeping the world running, delivering us our packages every day? I mean,
Yes.
Oh,
Yes.
yeah.
so
Yeah.
So I read an article this morning about a UPS worker who said he's been feeling sick and may have the virus, but he has to just put on his mask and his gloves and go to work every day because he's afraid he may lose his job. So,
Yeah.
there's a lot of sacrificing going on right now.
yes, it is.
There's a lot of
Yes, it is.
sacrificing on and then that's why it's a public health issue, meaning this is affecting everyone in one way or another, and some more than others because they are in service, they are public servants, they have jobs that require them to have more interaction with people. And so absolutely we need to keep everyone in prayer, specifically the people who are on front lines, whether that's in healthcare or just in general,
Mm-hmm.
and doing our best to help to what we say we saying flatten the curve, meaning that so this doesn't peak up and then there's so many people dying, like 700 people in Italy in one day, to flatten it where at some point we're just talking about zero. Because when we're looking at numbers, I was listening to Don Lemon on CNN, and he said, we're talking about these numbers and we're talking about low numbers, but every single one of those numbers is a person.
Yeah.
It's a human. It's
Yes.
somebody's mom, somebody's sister, somebody's brother, somebody's doctor, somebody's UPS worker
Yeah.
who has died. So it's really, really real out here. We're past one. We're past one at this point. But these are people who are gone. We will never have them on this earth again. And if we could just do our little part, I think it will. I know that it will make a huge difference. It's not that much of an inconvenience in comparison to people who are in hospitals with ventilators and people who are dying.
Yeah.
Definitely. And shout out to all these store owners, both big and small, who are deciding to say, hey, you guys are only allowed 1 pack of tissue, 1 milk, so that you leave something left behind for those elderly people or people who are disabled to come in and get what they need as well. Because the way we handled this in this country, I was really disappointed. I was initially shocked that people just immediately ran out and just said, you know what, I'm getting enough for me and my family. I'm not worried about anybody else. And we got to stop thinking that way, because when we start thinking more about a family, a union, everybody is our family. Everybody is our union. We all have to be bonded. And when we start thinking more like that as a country, then we start winning in life.
Yes.
You know what I mean? And only then is when we'll see that. And I think in hindsight, people were a little afraid. I get that, but I hope that they look back and see their actions and say, hey, if I could do it over again, I would do this different.
Yeah.
Yeah.
Absolutely. Or hey, if you need some tissue, I have a whole garage full.
Yeah.
I will sit it out on the curb, come and pick it up. Like, oh my goodness. Yes.
Eventually they
totally
started back up on my side. Yeah. It was out for a while over here on my side. I'm near Cyprus, and I was shocked. I was like, wow. Okay, so just forget everybody else that needs tissue, huh?
Yeah.
This is like, it's crazy.
Yeah, my husband yesterday, he went to the grocery store and said, he picked up the last case of water when he went grocery shopping yesterday. And it was a lady who seen him. He said he thought she was gonna say something, beat him up or something, say something to him, because she was looking at him
I'm
all
telling
crazy.
you. Yeah.
Because he picked up the last tank of
Yes.
water. We need a case of water too. And she
Lord,
already had a
I
in her
know.
cart. That was the thing. I mean,
Oh,
Yeah.
see, oh my goodness. I just hope that we just get better. In this whole kind of self, me, my, I,
yeah,
that will turn around, because it is pretty rampant where everybody is only concerned about themselves. A lot of people, not
Mm-hmm.
everybody,
yeah,
but a lot of people are only
Mm-hmm.
concerned about themselves.
I agree.
yeah.
Wow, it's been a complete honor talking to you today. We want to make sure that you shout out all of those websites or social media websites where people can find you in your practice.
Oh, thank you. Thank you. Again, Danny and Nikki, thank y'all so much for having me. I am Dr. Teriya Richmond, also known as your total health doctor. You can follow me on Instagram at Dr. T Richmond. You can follow me on LinkedIn at Teriya Richmond, Teriya. And typically, if you put that name in, it's going to pop up on most places with no other people but me. And then also on Facebook as Dr. Teriya M. Richmond.
Awesome. Thank you so much. We want to thank you for everything that you're doing for everyone out there.
Oh, and
We
also
want you to
Thank
stay
you.
safe.
one more thing, Danny,
Mhm.
before she goes, do you want to also tell our listeners where your practice is located as well? So
Oh,
when this
you,
is all
yes,
open,
thank you.
they can maybe
Thank you.
come out to your
My
office.
my
And do you want to
thank you. My
also tell us also, if
my
you could also tell our listeners what insurance you take, things like that as well.
okay. Absolutely. So my marketer would like pluck me over the head and say, "Did you not say anything about?" So the name of the center where my clinic is located. So the whole concept is well, the center is called Your Essential Healthcare Day Spa, and it is a place for all things women. So of course we have my medical clinic. We have a behavioral therapist. We have a full service spa for massages, facials,
Oh, wow.
and then we also have a
You should see me
nutritionist.
dancing. I'm dancing. Okay.
Oh
Okay.
yeah, we also have a nutritionist coming on board, and I'm still working in the process of building out a small physical activity area. So it is a place where you can come and obviously see your doctor, and then still get some of the other services that we need to just keep us healthy and whole. And I am located Third Ward, South Park area, 5751 Blythewood Street, Suite 200. And the clinic number, if you need an appointment, if you need telemedicine, if you're concerned and you want to just get assessed and to see if you need to go to the hospital or emergency room for COV ID 19, please feel free to call 832-215-5985. And we will be happy to help.
Awesome.
Yes. Thank you
Give
so
them that number one more time.
Sure. It's called Your Essential Healthcare and Day Spa, and the number is 832-215-5985.
All right. All right, Nikki. I'm sorry. Go ahead.
No, I was just going to say once again, thank you so much, Dr. Richmond. This conversation has definitely been very enlightening and definitely an eye opener. Just that reminder, because of course we've been hearing everything on the news, but to actually hear from a doctor personally and hear, hey,
Mhm.
this thing is real. We have to be
Yes.
very careful. It definitely put another hammer on a nail, for us to
Yes.
remind us.
Yes.
Be extremely careful. Make sure you're disinfecting everything and stay in the house if you don't have to go anywhere.
Yes. And wash your
Absolutely.
Yes,
hands, because I don't think people wash their hands in general a lot of times. So just
That's
simple on
true.
washing your hands.
yes,
And wash your bodies. Keep
yes,
everything clean, guys.
yes.
You know
Yes.
what I mean? Let's just work on. Let's practice being cleaner people in general.
Absolutely.
And pray. Pray and believe.
Yes, and pray.
Because
Yes.
yeah,
Yes.
we can't live in fear either, because if things are going to change. This is This is
Correct.
going to come to a head. We know that. We just have to keep
Yes,
hanging.
yes, and it will turn around.
Yes.
Yep, and it will pass. This too shall pass. We've been through a lot, and this will pass as well.
Absolutely. I love it. Well, we can't wait to distribute all this information out there on the social media. So we'll be uploading this content later on this evening. And thank you again, Dr. Richmond. You gave us a boat of wealth in health. I feel like health is our wealth.
Yeah.
You know what I
It
mean?
is.
Because at
It
the end of it
is.
all, that
It
paper didn't
is.
mean a thing, you know?
No. Nope.
Yeah. If you don't have your health.
Yeah.
So, um, yeah. So thank you again, Dr. Richmond. You take care of yourself. Nikki, be safe. And we want to tell our listeners thank you for tuning in each and every Sunday. We don't know which angle we coming at y'all each week,
I
considering this
know.
coronavirus, but we're going to get it to you some kind of way.
Yes.
All right, Nikki, you have any last words?
And no, ma'am, that's it.
All right. So as always, we want to thank you guys for tuning into the Sisters Talk podcast. You guys have a blessed and safe Sunday, and we'll see you again on next Sunday from 3 to 5 or maybe 3 to 4, depending on what the situation is. Be safe.
Thank you.
Thank you.
All right. Okay, now